winter is coming and maybe a rather dark one. Delhi National Capital Region and other parts of North India are experiencing a dip in temperature and a rise in air pollution. The deteriorating air quality index this October brings an added risk of COVID-19 transmission. A study by Harvard University found that only a small increase in air pollutants increases the risk of COVID-19 deaths by 8%. The current COVID-19 outbreak caused by severe acute respiratory syndrome coronavirus 2 is known to be severe in patients with long-term exposure to air pollutants as per a study by University of Cambridge. If a spike of only 1 microgram per cubic meter in PM 2.5 is critical as per the study, Delhi fluctuates between poor and severe AQI, way higher than the safe limits. The pandemic did bring in a stringent lockdown that is believed to have improved the air quality caused by car exhaust fumes and burning of conventional energy sources. Researchers also claim that improvement in air quality during the lockdown period might have restricted the transmission of the infection in some parts, including Kerala. In the fight against the novel coronavirus, India has maintained a fairly good recovery rate with relatively lesser deaths in terms of mortalities per million of the population. But the winter air can increase the caseload and mortality rate as people prepare for Diwali fireworks. Not just that, this can increase the spread of the virus as well. Mary Pruniki, Director of Air Pollution and Health Research at Stanford University, said, in addition to air pollution decreasing immune defenses, it is thought that the particulate and nitrogen dioxide found in air pollution can act as vectors for the spread and survival of airborne particles such as COVID. One study of mice found that nitrogen dioxide increases the number of receptors to which the virus binds 100-fold. Stubble burning and industrial pollution layers the northern part of the country with poisonous gases. High wind speed helps disperse pollution, but with the withdrawal of monsoon, the wind direction brings dust from neighboring regions. The low speed wind keeps the situation alarming in winters. The health infrastructure can get overwhelmed quickly as co-infections like dengue, malaria and seasonal flu, among others, rise in the season. As COVID-19 can cause permanent lung damage with other long-term ailments, inflammation caused by pollution makes matters worse, especially in comorbid patients. In diabetic patients, if the pollutants travel to the bloodstream and organs, it increases insulin resistance. SARS outbreak of 2002 to 2004 and yearly spread of influenza are associated with pollution levels, cites the Stanford University research. As people become more vulnerable to the virus, a green war room has been set up at the Delhi Secretariat to monitor pollution and other measures. If dust particles can mix with infected saliva droplets, the transmission can become more airborne and hard to contain.